in essence, I have a passion for education, and early in my clinical career, which is now 32 years ago, I felt that it would be important to allow for an educational element for the referring dentists that I worked with. I had a clinician come once a year and have a full-day program and open this up to all of the dentists in the community. It more or less evolved into my wanting to educate personally myself, and I began to do that. I began to have some evening sessions with some of the dentists that we worked with, and as I became very interested and passionate about implant surgical reconstruction, then it became even more easy to talk about all that. And what then started to happen is I had folks from other parts of the country call me for advice, and one thing led to another. Finally, I just thought, well, why don't I just bring in 8-10 of these folks and let's have at it for a day, and I think it would be easier to get everybody in at one time and educate them. It was a one-day scenario, and then it became a 2-day, and finally even a 3-day bone grafting course. And then since that first year, which was now 1990, fast forward 25 years later, and with pride I can say that I've now educated more than 3,100 clinicians from all 50 states and 32 countries. They are all alums of my institute. And that course that started out as just a 3-day bone grafting course evolved now into 3 different bone grafting courses, a soft tissue grafting course, and a course on guided surgery, which is now the new way, so to speak, the high-tech way, the digital way of planning all of our implant cases. And I have a great advantage in terms of being able to offer through our institute cutting-edge technology and education to clinicians from all over the world. And it has been really a tremendous joy for me to fulfill that educational urge that I've always had. And so I look at it as having the best of both worlds, meaning I am a clinician first and foremost, but I'm also an educator. The Institute itself offers a very unique opportunity for clinicians to learn cutting-edge surgery that's basically implant reconstruction based, such that there's really nothing quite like it anywhere in the world, because we offer live surgery during these courses, lecture discussion, high-definition video. So what began as just a little get-together has blossomed into a full-blown institute, such now that we have our own physical building and an educational format and venue that allows us to really perform our work in a very, very high-tech mode, and most importantly in a very professional mode. We're able to allow clinicians to leave, and on Monday morning they can incorporate these procedures into their practices. That has been fulfilling for me, because indirectly I'm influencing not just them, but certainly all of their patients throughout the world. So it's been fun, I've enjoyed it, and the Pikos Institute continues to thrive and do well.